Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Finerenone in heart failure with mildly reduced or preserved ejection fraction. Background. Steroidal mineralocorticoid receptor antagonists reduce morbidity and mortality among patients with heart failure and reduced ejection fraction, but their efficacy in those with heart failure and mildly reduced or preserved ejection fraction has not been established. Data. Regarding the efficacy and safety of the nonsteroidal mineralocorticoid receptor antagonist Finerenone in patients with heart failure and mildly reduced or preserved ejection fraction are needed. In this international, double-blind trial, we randomly assigned patients with heart failure and a left ventricular ejection fraction of 40% or greater, in a 1-to-1 ratio, to receive Finerenone, at a maximum dose of 20 mg or 40 mg once daily, or matching placebo, in addition to usual therapy. The primary outcome was a composite of total worsening heart failure events, with an event defined as a first or recurrent unplanned hospitalization or urgent visit for heart failure, and death from cardiovascular causes. The components of the primary outcome and safety were also assessed. Results. Over a median follow-up of 32 months, 1,083 primary outcome events occurred in 624 of 3,003 patients in the Finerenone group, and 1,283 primary outcome events occurred in 719 of 2,998 patients in the placebo group. Rate ratio, 0.84. 95% confidence interval, CI, 0.74 to 0.95, p equals 0.007. The total number of worsening heart failure events was 842 in the Finerenone group and 1,024 in the placebo group. Rate ratio, 0.82. 95% CI, 0.71 to 0.94. P equals 0.006. The percentage of patients who died from cardiovascular causes was 8.1% and 8.7%, respectively. Hazard ratio, 0.93. 95% CI, 0.78 to 1.11. Finerenone was associated with an increased risk of hyperkalemia and a reduced risk of hypokalemia. Conclusions. In patients with heart failure and mildly reduced or preserved ejection fraction, Finerenone resulted in a significantly lower rate of a composite of total worsening heart failure events and death from cardiovascular causes than placebo. Amivantamab plus Lazertinib in previously untreated EGFR-Mutated advanced NSCLC. Background. Amivantamab plus Lazertinib, Amivantamab-Lazertinib, has shown clinically meaningful and durable antitumor activity in patients with previously untreated or osimertinib pretreated EGFR, epidermal growth factor receptor mutated advanced non-small cell lung cancer, NSCLC, methods. In a Phase 3, international, randomized trial, we assigned, in a 2-to-2:1 ratio, patients with previously untreated EGFR-mutated, exon 19 deletion or L858R, locally advanced or metastatic NSCLC to receive Amivantamab Lazertinib, in an open-label fashion, osimertinib, in a blinded fashion, or Lazertinib, in a blinded fashion, to assess the contribution of treatment components. The primary endpoint was progression-free survival in the Amivantamab Lazertinib group as compared with the osimertinib group, as assessed by blinded independent central review. Results. Overall, 1,074 patients underwent randomization, 429 to Amivantamab Lazertinib, 429 to osimertinib, and 216 to Lazertinib. The median progression-free survival was significantly longer in the Amivantamab Lazertinib group than in the osimertinib group, 23.7 versus 16.6 months. Hazard ratio for disease progression or death, 0.70, 95% confidence interval, CI, 0.58 to 0.85, p less than 0.001. An objective response was observed in 86% of the patients, 95% CI, 83 to 89, in the Amivantamab Lazertinib group, and in 85% of those, 95% CI, 81 to 88, in the Osimertinib group. Among patients with a confirmed response, 336 in the Amivantamab Lazertinib group and 314 in the Osimertinib group. The median response duration was 25.8 months, 95% CI, 20.12 could not be estimated, and 16.8 months, 95% CI, 14.8 to 18.5, respectively. In a planned interim overall survival analysis of Amivantamab Lazertinib as compared with Osimertinib, the hazard ratio for death was 0.80, 95% CI, 0.61 to 1.05. Predominant adverse events were EGFR-related toxic effects. The incidence of discontinuation of all agents due to treatment-related adverse events was 10% with Amivantamab Lazertinib and 3% with Osimertinib. Conclusions. Amivantamab Lazertinib showed superior efficacy to Osimertinib as first-line treatment in EGFR-mutated advanced NSCLC. Collagenase injection versus limited fasciectomy for Dupuytren's contracture. Background. Treatments for Dupuytren's contracture include limited fasciectomy and collagenase injection. Comparisons of the effectiveness of these treatments have been limited. We performed an unblinded, multicentre, pragmatic, two-group, randomised, controlled non-inferiority trial comparing collagenase injection with limited fasciectomy in persons with moderate Dupuytren's contracture. The primary outcome was the score on the Patient Evaluation Measure Hand Health Profile, PEM, a questionnaire for assessing hand health as reported by the patient, at 1 year after treatment. Scores on the PEM range from 0 to 100, with higher scores indicating worse outcomes. The pre-specified non-inferiority margin was 6 points. Results. A total of 672 persons, 336 per group, were assigned to receive collagenase injection or to undergo limited fasciectomy. The primary analysis included 599 persons, 314 in the collagenase group and 285 in the limited fasciectomy group. The mean score on the PEM at 1 year was 17.8 among the 284 patients with available data in the collagenase group and 11.9 among the 250 patients with available data in the limited fasciectomy group. Estimated difference, 5.9 points, 95% confidence interval, CI, 3.1 to 8.8. One-sided p equals 0.49 for non-inferiority. Among the patients with available data, 229 patients in the collagenase group and 197 patients in the limited fasciectomy group. The estimated difference in the mean score on the PM at 2 years was 7.2 points, 95% CI, 4.2 to 10. Collagenase group, and in 5.1% of those in the limited fasciectomy group, recurrent contracture resulted in reintervention in 14.6% and 3.4%, respectively. Collagenase injection was not non-inferior to limited fasciectomy with respect to the score on the PEM at 1 year after treatment. Next, we will be discussing articles from Journal of American Medical Association Dialysis Facility Staffing Ratios and Kidney Transplant Access Among Adolescents and Young Adults. Question: is dialysis facility staffing associated with access to waitlisting and kidney transplant among adolescents and young adults receiving dialysis? Findings: in this cohort of individuals aged 12 to 30 years receiving maintenance dialysis, treatment at facilities with the highest versus lowest quartile of patient to social worker ratios was associated with 5% lower incidence of waitlisting. Treatment at facilities with the highest versus lowest quartile of patient to nurse or patient to social worker ratios was associated with a 14% to 15% lower incidence of transplant, meaning Higher staffing ratios at dialysis facilities were associated with lower access to waitlisting and transplant for adolescents and young adults. Expanded newborn screening using genome sequencing for early actionable conditions. Question: what is the parental acceptance, feasibility, and screen-positive rate of targeted genome screening in newborns of different racial and ethnic groups? Findings: in this study of 4,000 newborns, 72.0% of approached families consented to participate. Genome sequencing was successfully completed for 99.6% of participants. The screen-positive rate in a predefined gene panel was 3.7%, meaning targeted analysis of a predefined set of genes from genome sequencing for screening in a diverse newborn population is feasible and could expand the scope of newborn screening. Next, we will be discussing articles from Annals of Internal Medicine. Colorectal cancer screening completion and yield in patients aged 45 to 50 years, an observational study. Background: guidelines now recommend initiating colorectal cancer, CRC, screening at age 45 years rather than 50 years, but little is known about screening completion and yield among people aged 45 to 49 years. Objective: to evaluate fecal immunochemical test, FIT, completion and yield in patients aged 45 to 49 versus 50 years results. A total of 267,732 FIT kits were distributed, 213,928, 79.9%, to patients aged 45 to 49 years, and 53,804, 20.1%, to those aged 50 years. Overall, FIT completion was slightly higher in patients aged 45 to 49 years, 38.9% versus 37.5%. Adjusted risk ratio, R, 1.05, 95% CI, 1.04 to 1.06. Although at Colorado, those aged 45 to 49 years were substantially less likely to complete a FIT, 30.7% versus 40.2%. R, 0.77, CI, 0.73 to 0.80. Overall, FIT positivity was lower in patients aged 45 to 49 years, 3.6% versus 4.0%. R, 0.91, CI, 0.84 to 0.98, and receipt of colonoscopy after a positive FIT result was similar between groups, 64.9% versus 67.4%. R, 1.00, CI, 0.94 to 1.05. Adenoma detection was lower in the younger group, 58.8% versus 67.7%. R, 0.88, CI, 0.83 to 0.95. Yields were similar for adenoma with advanced histology, 13.2% versus 15.9%. R, 0.86, CI, 0.69 to 1.07. Polyp with high-grade dysplasia, 3.4% versus 5.1%. R, 0.68, CI, 0.44 to 1.04. Sessile serrated lesion, 10.3% versus 11.7%. R, 0.92, CI, 0.71 to 1.21. And CRC, 2.8% versus 2.7%. R, 1.10, CI, 0.62 to 1.96. Conclusion: similar FIT completion and yield rates in people aged 45 to 50 years support initiation of CRC screening at age 45 years. Next, we will be discussing articles from British Medical Journal. Association of Holidays and the Day of the Week with Suicide Risk, Multicounty, Two-Stage, Time Series Study. Objectives: to assess the short-term temporal variations in suicide risk related to the day of the week and national holidays in multiple countries. Conclusions: suicide risk was highest on Mondays and increased on New Year's Day in most countries. However, the risk of suicide on weekends and Christmas varied by country and territory. The results of this study can help to better understand the short-term variations in suicide risks and define suicide prevention action plans and awareness campaigns. Next, we will be discussing articles from Lancet. Induction chemotherapy followed by standard chemoradiotherapy versus standard chemoradiotherapy alone in patients with locally advanced cervical cancer. GCIG INTERLACE, an international, multicentre, randomised phase 3 trial. Background: locally advanced cervical cancer is treated with chemoradiotherapy, standard of care, but many patients still relapse and die from metastatic disease. We investigated chemoradiotherapy with or without induction chemotherapy to determine whether induction chemotherapy improves both progression-free survival and overall survival by interpretation. Short-course induction chemotherapy followed by chemoradiotherapy significantly improves survival of patients with locally advanced cervical cancer. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Social characteristics and adherence to adjuvant endocrine therapy in premenopausal women with breast cancer. Purpose: social characteristics, including cohabitation/marital status and socioeconomic position, SEP education level, employment status, and income, influence breast cancer prognosis. We investigated the impact of these social characteristics on adherence to adjuvant endocrine therapy, AET, from treatment initiation to 5 years after diagnosis conclusion. Adherence to EAT was lower among women living alone or unemployed than cohabiting or employed women, respectively. These women may benefit from support programs to enhance EAT adherence. Here are the articles from Journal of Hepatology: Diagnostic Performance of Non-Invasive Tests in Patients with MET ALD in a Health Checkup Cohort. The effectiveness of NITs for detecting liver fibrosis in patients with MET ALD is not well established. In a study of 7,918 participants undergoing MRE, FIB4 achieved an ORAC of 0.85 for detecting advanced fibrosis, MRE greater than or equal to 3.6 kilopascals. Sensitivity, 71.4%, specificity, 77.3%, and both positive, 4.6%, and negative, 99.4%. Predictive values of FIB4 were similar for MET ALD as for MOSLD. FIB4 is established as a valuable screening tool for identifying advanced fibrosis in the MET ALD population. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Effective brain-gut behavioral treatments on abdominal pain in irritable bowel syndrome. Systematic review and network meta-analysis. Background and aims. Some brain-gut behavioral treatments, BGBTs, are beneficial for global symptoms in irritable bowel syndrome, IBS. United States management guidelines suggest their use in patients with persistent abdominal pain, but their specific effect on this symptom has not been assessed systematically. Conclusions. Several BGBTs, including self-guided/minimal contact CBT, face-to-face multi-component behavioral therapy, and face-to-face gut-directed hypnotherapy may be efficacious for abdominal pain in IBS, although none was superior to another. Targeting 5-hydroxytryptamine receptor 1A in the portal vein to decrease portal hypertension. Background and aims. Portal hypertension, PH, is one of the most frequent complications of chronic liver disease. The peripheral 5-hydroxytryptamine, 5-HT, level was increased in cirrhotic patients. We aimed to elucidate the function and mechanism of 5-HT receptor 1A, HTR1A, in the portal vein, PV, on PH. Conclusions. Our findings reveal that 5-HT promotes PH by inducing the contraction of the PV and identify HTR1A as a promising therapeutic target for attenuating PH. As an HTR1A antagonist, Alvarine is expected to become a candidate for clinical PH treatment. Here are the articles from Clinical Gastroenterology. Vancomycin is efficacious for treatment of heartburn in non-erosive reflux disease, a randomized trial. Background and aims. Potassium-competitive acid blockers have documented efficacy for erosive esophagitis. We performed a randomized trial in United States subjects diagnosed with non-erosive reflux disease of vancomycin versus placebo for 4 weeks, followed by a 20-week active treatment extension. DONS conclusions. Vancomycin reduced heartburn symptoms in subjects diagnosed with non-erosive reflux disease, with the benefit appearing to begin as early as the first day of therapy. Treatment effect persisted after the initial 4-week placebo-controlled period throughout the 20-week extension period. The 2 vancomycin doses, 10 mg and 20 mg, were similar in efficacy. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Comparative safety of different antibiotic regimens for the treatment of outpatient community-acquired pneumonia among otherwise healthy adults. Background. Evidence is limited about the comparative safety of antibiotic regimens for treatment of community-acquired pneumonia, CAP. We compared the risk of adverse drug events, ADAs, associated with antibiotic regimens for CAP treatment among otherwise healthy, non-elderly adults. Conclusions. Broad-spectrum antibiotics were associated with increased risk of ADAs among otherwise healthy adults treated for CAP in the outpatient setting. Antimicrobial stewardship is needed to promote judicious use of broad-spectrum antibiotics and ultimately decrease antibiotic-related ADAs. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. Factors associated with successful withdrawal of biologic agents in children with colchicine-resistant familial Mediterranean fever. Background. Familial Mediterranean fever, FMF, is a monogenic autoinflammatory disease, and colchicine is the mainstay of treatment. Approximately 5% to 10% of patients may respond inadequately to colchicine, and anti-interleukin-1, anti-IL-1, agents are important treatment options in these patients. The aim of this study was to see whether there is any factor associated with the withdrawal of these anti-IL-1 agents and to investigate the characteristics of colchicine-resistant FMF patients who needed biological therapy. Conclusions. Low ISSF scores before biological treatment with no accompanying exertional leg pain. Subclinical inflammation and comorbidities may be stated as an associated factors in terms of the discontinuation of biological agents in colchicine-resistant pediatric FMF patients. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Novel long non-coding RNA heat 4 affects monocyte subtypes, reducing inflammation, and promoting vascular healing. Background. Activation of the immune system contributes to cardiovascular diseases. The role of human-specific long non-coding RNAs in cardioimmunology is poorly understood. Tonsiogens. These results characterize a novel endogenous anti-inflammatory pathway that involves the conversion of monocyte subtypes into anti-inflammatory CD16+ monocytes. The data identify novel function for the class of long non-coding RNAs by preventing protein secretion and suggest long non-coding RNAs as potential targets for interventions in the field of cardioimmunology. Here are the articles from Journals of the American College of Cardiology. Heart failure risk assessment using biomarkers in patients with atrial fibrillation. Analysis from Combine AF background. Heart failure, HF, is common among patients with atrial fibrillation, AF, and accurate risk assessment is clinically important. Objectives. The goal of this study was to investigate the incremental prognostic performance of N-terminal pro-B type natriuretic peptide, NT-proBNP, high-sensitivity cardiac troponin T, HSC10T, and growth differentiation factor, GDF-15 for HF risk stratification in patients with AF. Conclusions. NT-proBNP, HSC10T, and GDF-15 contributed significantly and independently to the risk stratification for HF endpoints in patients with AF. with HSCTNT being as important as NT-proBNP for HF risk stratification. Our findings support a possible future use of these biomarkers to distinguish patients with AF at low or high risk for HF. From JAMA Cardiology. Leadless ultrasound-based cardiac resynchronization system in heart failure. Question: is leadless left ventricular, LV, endocardial pacing using ultrasound energy safe and effective for providing cardiac resynchronization therapy, CRT, to patients whose conventional CRT using a coronary sinus lead failed? Findings: in this prospective clinical trial, N equals 183, 80.9% of patients were free from device and procedure-related adverse events. The average improvement in mean LV and systolic volume was -16.4%, meaning, in this study, for patients with failed coronary sinus lead placement for CRT, a leadless LV pacing system using ultrasound energy holds promise as a viable alternative. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Obesity, Inflammation, and Clinical Outcomes in COVID-19, a multicenter prospective cohort study. Context: obesity is a risk factor for coronavirus disease 2019, COVID-19 related outcomes. However, the mechanism remains unclear. Conclusion: obesity is associated with worse outcomes in COVID-19, notably in younger participants and in the pre-Omicron era. Inflammation, as measured by SUPAR, is a significant mediator of the association between obesity and COVID-19 outcomes. Here are the articles from Diabetes Care. Empowering hospitalized patients with diabetes. Implementation of a hospital-wide CGM policy with EHR-integrated validation for dosing insulin. Objective: we aimed to assess the feasibility, clinical accuracy, and acceptance of a hospital-wide continuous glucose monitoring (CGM) policy with electronic health record, EHR-integrated validation for insulin dosing. Conclusions: implementation of a hospital-wide inpatient CGM policy supporting multiple CGM types with real-time accuracy monitoring and integration into the EHR is feasible. Initial feedback from nurses and patients was favorable, and further investigation toward broader use and sustainability is needed. Use of financial incentives to promote adolescent type 1 diabetes self-management. A pilot randomized controlled trial. Objective: to evaluate whether financial incentives lead to improvement in self-management behaviors and glycemia in adolescents with type 1 diabetes, T1D. Results: compared with a mean 41% behavioral goal attainment within the non-financial incentives arm, mean behavioral goal attainment under gain and loss frames was 50%, p less than 0.01, and 45%, p less than 0.01, respectively. Mean time in range, TIR, in gain frame and loss frame arms was higher 43%, p less than 0.01, and 42%, p less than 0.01, respectively, compared with when not receiving financial incentives, 38%. There was no difference in A1C among the three arms. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Frequency and longitudinal course of behavioral and neuropsychiatric symptoms in participants with genetic frontotemporal dementia. Background and objectives. Behavioral and neuropsychiatric symptoms are frequent in patients with genetic frontotemporal dementia, FTD. We aimed to describe behavioral and neuropsychiatric phenotypes in genetic FTD, quantify their temporal association, and investigate their regional association with brain atrophy. Discussion. We identified multiple clusters of behavioral and neuropsychiatric symptoms in participants with genetic FTD that relate to distinct cerebral atrophy patterns. Their severity depends on time, affected gene, sex, and education. These clinical genetic associations can guide diagnostic evaluations and the design of clinical trials for new disease-modifying and preventive treatments. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles. From Chest. Characteristics of adults with severe asthma in childhood. A 60-year follow-up study. Background. Childhood asthma is a prevalent condition with potential impacts on adult life. Research question. In a 60-year follow-up study of adults with a history of severe childhood asthma, what are the potential differences and characteristics between individuals with persistent asthma and asthma remission in adulthood? Interpretation. Our 60-year follow-up study of adults with a history of severe childhood asthma revealed that 9 of 10 participants still had current asthma. Persistent asthma was associated with lower lung function and higher levels of type 2 inflammatory biomarkers compared with asthma remission. Here are the articles. From the American Journal of Respiratory and Critical Care Medicine. Genetically predicted body mass index and mortality in chronic obstructive pulmonary disease. Rationale: body mass index, BMI, is associated with chronic obstructive pulmonary disease, COPD, mortality, but the underlying mechanisms are unclear. The effect of genetic variants aggregated into a polygenic score may elucidate the causal mechanisms and predict risk. Objectives: to examine the associations of genetically predicted BMI with all-cause and cause-specific mortality in COPD. Conclusions: in people with COPD, a higher genetically predicted BMI is associated with higher cardiovascular mortality but not respiratory mortality. Individuals with a discordantly low BMI have higher all-cause and respiratory mortality rates than those with a concordant BMI. Next, we will be discussing articles in the field of nephrology. Here are the articles. From Clinical Journal of American Society of Nephrology. Urine output and acute kidney injury in neonates/younger children, a prospective study of cardiac surgery patients with indwelling urinary catheters. Key points. Using indwelling urinary catheters, urine output, UO, shows good performance in neonates and younger children. Using higher UO thresholds in neonates post-cardiac surgery improves discriminatory capacity for outcomes compared to neonatal kidney disease, improving global outcomes. In younger children, 1 to 24 months, higher UO thresholds were not better than the adult kidney disease, improving global outcomes criteria. Here are the articles. From Kidney International Reports. Elevated ambient temperature associated with increased cardiovascular disease risk among patients on hemodialysis. Introduction. In many parts of the world, ambient temperatures have increased due to climate change. Due to loss of renal function, which impacts the regulation of thermoregulatory mechanisms, the ability to adapt and to be resilient to changing conditions is particularly concerning among individuals with kidney failure. The aim of this study was to assess the effect of heat on mortality and healthcare utilization among U.S. patients on hemodialysis results. Overall, exposure to high temperature is associated with elevated risk for both mortality and healthcare utilization among hemodialysis patients. The risk ratios for all-cause mortality and daily temperature were 1.07, 95% confidence interval, CI, 1.03 to 1.11, 1.17, 1.17, 1.14 to 1.21, for fluid disorder-related hospital admissions, and 1.19, 1.16 to 1.22, for cardiovascular event-related emergency department, ED, visits, comparing 99th percentile versus 50th percentile daily temperatures. Larger effects were observed for cumulative lagged exposure 3 days prior to the outcome and for southwest and northwest climate regions. Conclusion. Heat exposure is associated with elevated risk for cardiovascular disease, CVD-related mortality and healthcare utilization among this vulnerable population. Furthermore, the effect appears to be potentially cumulative in the short term and varies geographically. Lower parathyroid hormone levels are associated with reduced fracture risk in Japanese patients on hemodialysis. Introduction. Secondary hyperparathyroidism, SHPT, affects bone metabolism and may lead to bone fragility. However, there is conflicting evidence as to whether parathyroid hormone, PTH, levels are associated with fracture risk and whether the relationship is linear or U-shaped. Results. At baseline, the median intact PTH level was 141 pg/ml, interquartile range, 78 to 226 pg/ml. During 1 year of follow-up, there were a total of 3,762 fractures requiring hospitalization, 1,361 hip, 551 vertebral, and 1850 other. In an adjusted analysis, higher baseline PTF levels were associated with an incrementally increased risk of any fracture, odds ratio, OR, per doubling of intact PTH, 1.06, 95% confidence interval, 1.03 to 1.09. The association between PTF levels and fracture risk was more pronounced for hip fractures but not found for vertebral fractures. The absolute risk difference associated with higher PTF levels appeared to be more pronounced in older individuals, females, and those with lower body mass index, BMI. Change in PTF levels was also associated with fracture risk. The adjusted OR for fracture decreased linearly with decreasing PTF levels over 1 year, regardless of the preceding PTF levels. Conclusion. Lower PTF levels are associated with a graded reduction in fracture risk. Further studies are needed to determine whether intensive PTH control reduces fracture risk.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.